So, doctor, thank you for being here.
Good to be here.
This is really interesting. We were just talking about this because, first of all, you don't think a whole lot about vitamin B12.
Yeah, doctors and of course ourselves don't necessarily think about that, but you're right. I mean, B12 is a very essential element, very essential vitamin for the development of red blood cells, which are important in the development of hemoglobin, transporting oxygen through our cells,
Yeah.
and then also important for our neurological system. So it's very vital functions.
So what happens when you are deficient, vitamin B12 deficient?
So when you're deficient, I mean, you'll be anemic, so you'll tend to be tired, lethargic, weak. You may have dizziness, ringing or tinnitus in the ears. And then you may have problems, neurological problems. Classic symptoms are what are called a peripheral neuropathy. So you'll have decreased sensation. You may have this pins and needles sensation in your lower extremities and your feet.
Yeah.
And all those sorts of symptoms can be tinnitus or ringing in the ears. All those can be signs or symptoms of an underlying lack of B12 in your diet.
Well, who's most at risk?
So most at risk are people that don't eat any kind of animal products.
So vegan, vegetarian.
Vegans and vegetarians, because it's found in great quantities in meats, poultry, and milk, and eggs and other dairy products. But if you're not taking that, then you're probably going to be deficient. So if you have that kind of a problem, you want to be aware of it and obviously treat it.
Okay, so here's the thing. Then people are going to start to think, oh, well, I'm tired all the time. Sometimes I get pale, sometimes this and that. How do we know exactly if we are vitamin B12 deficient?
Well, so the way obviously is to go and see your physician. There are some tests that can be done to determine your B12 levels. And then again, to be aware of your diet. You know, there's a very interesting study, very small study that was done on two people, a teenage girl and an adult male. And they were found to be deficient in B12 levels, and this was disturbing their sleep patterns. And when they actually reversed it and gave them B12, their sleep patterns improved, and when they stopped the B12, they reversed. Again, it's only two people, but it's interesting that there may be some association between inadequate amounts of B12 and our sleep patterns.
Okay, so then here's my question. You mentioned, let's say, you know, vegans, vegetarians, and not to scare anyone, but say that they are deficient. What can they do then to make sure that their amounts go up?
So obviously, if they're vegans or vegetarians, you want to make sure that you're still taking B12, and you can get B12 from fortified grains, obviously supplements or other ways to obtain adequate amounts of B12.
So you would have to go to your physician, though, for sure, to just make sure.
To make sure that this is a problem that you have, correct.
Okay, and then I'm seeing here something about children. Are we talking about children and how much they should be getting?
So there are daily recommended amounts of how much vitamin B12 you would need. Obviously, when you're quite young, the amount that you need is a much smaller quantity. It gradually increases with age. And the largest quantity of B12 that we need is when women are pregnant, and the highest is when they're breastfeeding, because obviously there is more need to that for a child during that period of time.
And lastly, any prevention? I mean, what can we do to just make sure that we don't get to that point? Because no one likes to feel dizzy or really tired all the time.
So first of all, being aware of it, like anything that we do in medicine, we want to be aware of it, aware of how we're feeling, going to see your physician if there is something, and being careful about your diet. So if you're cutting out certain essential portions of a diet the dietitians tell us need as certain food groups, we want to make sure that we're replacing those with supplements so we're getting the nutrition that we need.
Oh gosh, who would have thought? Well, thank you so much.
Sure.
Another thing too, like you said, just to be aware about.
Right.
Thank you so much, Dr. Chaffoo.
Sure, good to see you.